This is part 1. Part 2, hand mixing, is your putty. Because you all do this by hand. Does that make sense? Okay. And then on the back side is your impression material automixer. It is in your 2, what did we say these are called again? Cartridges?
Automixer.
Automixer. We're using it in our automixer handler looking things. Okay.
Where's your other automixer for your
My
polyether?
against is over there.
Ah.
It's in the cupboard.
Okay, what was this one?
That is our impregum. That's our first hand mixing.
Catalyst.
Okay.
This one's a catalyst?
Yep. So when you have this, obviously you would be, in your PPE because you're doing this at your op or somewhere around your op because that's where you either have your automixer thingies or your Pentamix machine, which is this is the Pentamix machine right over here.
What's the
My
thing?
new baby. Got him not too long ago. Use him every now and then. Second semester, we'll get them out. You guys can master this. But this is the machine. This is your base and your catalyst. Just like in our cartridges, we have a base and catalyst on one side and then those 2 tubes. Okay? All this does is it just push a button and it squirts out.
The automixer is the same that you're hand mixing.
Okay.
Simple.
So with this one, you're going to have your appropriate materials, which is your base, your catalyst. You're going to have a triple tray. You're going to have adhesive. You're going to have your spatula for your impression material. And remember, this is a little different. So I know when you guys are getting out your beaver tails for when we're doing our things, our impressions on each other, we have these types of spatulas. Okay, this is the one that you're needing for our impregum.
Does that have a name?
I'm sure it does. But I don't know it.
One was, I think, a beaver tail.
The beaver tail is what we use
Adhesive.
for impressions and
Yeah.
pouring for stone. I just called this the automixer one because I'm now the automixer. If you think about it, when you're using this on your big spatula, it's a little bit easier to control your material versus the big one. Your big mixing pad, these are all found in the Crown and Bridge material cabinet right here. All at the bottom, there's the putty, the mixing pads, your impregum, along with your blue bite, your monophase, your light body, heavy body. Okay, so it says you're going to load your adhesive on your tray, okay? And so when you're placing your adhesive, please be very careful that you don't spill this. And you're placing it on your plastic part of your tray, okay? You're not putting it on your mesh because your material goes on your mesh, okay? Do top and bottom,
Oh, got it.
okay? All on the plastic part. This is just to make sure that it's gonna adhere. And you wanna know what? It's gonna adhere. But this is extra security. Okay? When you do this, you're going to have equal parts. Okay? So if I have a whole quad that I'm gonna do, I'm gonna make sure I have enough material, right? I'm just going to demonstrate a small area. I'm not going to stretch this out 6 inches. I'm only going to do 2 inches because all I'm doing is showing you how to do this. I'm not actually going to be putting this in a patient's mouth, okay? So equal parts, squirt that out, and then you recap it, okay? So there's my base, and then now the catalyst, same thing. It's the equal length. It's not equal width, okay? Because you're not going to get the width because this is a tiny hole versus a big hole. There you go. Okay? Let me get a cute little chomper over here. I'll take this. And then I'll get another. So now I'm going to mix these into a homogeneous mixture. What does that mean?
Well mixed.
Yep. I'm not gonna do a cute little marble like that. Is that mixed? No. And so just like when we're manipulating our cements, you are adding some muscle into it. You're using the side. I'm staying in one area. I'm not using this all over my whole entire mixing pad. Getting all the sides spatulated back and forth. This should be, does it say how long to do it? A couple seconds, minutes, hours? Okay. It's now homogeneous mixture. It's all nice and purple.
It does look like that.
Okay, 5 seconds. Okay. So just like when we do our cements, you just scoop it up, just like so. I'm gonna place it in my tray. There we go. And then I'm just gonna take a little bit left and put it on the bottom. But if I were to do this in real life, I would have enough for my whole entire tray, right? Upper and lower, because a triple tray is your maxillary, your mandibular, and your bite at the same time. And so then I'm going to place this in my patient's mouth, and then they're going to bite down and hold that, like so. Okay. I will say the only time I've ever had to hand mix anything, it was with my nasty gasoline stuff to reline a denture. That was the only time. Everything else was either in a printing machine or in the automixer for your hands. What? It was kind of like a rubber bit. It was awful. It was for a reline. It was so stinky. It was so messy, but we needed it, and we only did it once because it was this one older man that just really needed his denture fixed. This stuff is really nice. It just wipes off if you forget about it. It's not the end of the world. You just peel it off because it turns into your lovely.
Just don't get it on
Yeah.
your clothes.
Yeah, it will ruin clothes. It'll ruin your pants. I have a pair that I ruined, and then you just. I'll show you here in a second. You can just rub that off. In real life, we wouldn't. We would throw it away, right? Right. Okay. So there's that one, and now you're going to list identify the uses of materials. So what do you think this first hand mixing with the impregum, which is basically a medium body, what do you think we would use for this? Yeah, so you could use it as a preliminary. You could also use it as a final impression as well. It's a medium body. Remember, we have light, medium, and heavy. Okay. Next one is your putty, and then you're going to use a closed quad tray. These are the closed quad trays. I might as well just keep them. And I'm probably going to order some more. I don't know why I don't have a brand new one of these in here. So make sure you keep your lids catalyst to catalyst, okay? Base to base, just so we're not being all confused.
Mm-hmm.
White to white, purple to purple, okay? So what you're doing is equal scoops. Okay, so when you do this, do an equal scoop. There you go. There's one scoop. Yeah, this got, believe it or not. Equal scoops. Okay. Somehow this got not sealed very well, even though it doesn't have the other opponent in it. It got dried out, and it's hard and crusty. Okay, everything else feels pretty decent. So we have our base and our catalyst. Now we're going to mix this fun. Is this a homogeneous mixture? No, we can't have marble. I know it looks so pretty though. We can't. And you just do this in your hands, back and forth, until it's all nice in one color. Okay, homogeneous mixture, nice and purple, no white. And you just kind of roll it up into a cute little sausage. And then you're gonna place it into your quad tray. Like so. Okay? That's probably still setting up on that one. So let me put it on this guy. He's missing his chompers. Obviously, it can go on the upper right, or upper left, or the lower right. Okay, you can't put this on any other area. And then you just push that in there. Do you tell the patient to bite down on this one? Why? Yeah, it's closed. It's not a triple tray where we're needing the bite. It's just gonna be this quad that's getting captured. Okay? There we go. We'll let that sit. So what do you think the uses are for this?
Couldn't this one also be a prelim or a final?
Yes. This is more rigid and hard. These are great for preliminaries when you do veneers, even anything anteriorly, especially if you're doing a wax up before you do your veneers, because it's controlled. It's a putty. It's a lot thicker than what your impression materials are. You can use this for your preliminary and a final. Only time we used the putty system was for the preliminary on veneers that we did a wax up on. Which that means you take an impression of a patient, you take it to lab, and you have a torch and wax and all your lab materials, and you're re-sculpting their teeth. So they have a different shape, they're longer, they're skinnier, they're just completely different. And that's usually when you do like your cosmetic, you know, like I have really small teeth, I want big teeth, or vice versa. And so you're
wax up and what the outcome will be at the end.
And they like it.
Vampire teeth?
Yeah.
Yeah, I had two patients that actually did that.
What was your reaction? Were you just like,
Just did them, paid for them.
yeah. I saw that on
And then I had other patients were filing down their
We'll
canines
pass that one around.
because they didn't want the sharpness. Because their teeth were naturally going
That's nasty.
And then here's this one. Beautiful. We'll pass that around.
I like this material.
I like this.
He built up his canines to look more sharp for Halloween. I saw that one.
You just did it with
Okay.
composite, then you can shave it off.
Alrighty. The homogeneous mixture for your base. Passing that around. Doing the other hand mixing with your impregum. Passing that around. If you look at this, this is nice and dry, and when it's on the board, you can just kind of rub it off with your finger. It's almost kind of like putting your Elmer's glue on your hand and peeling it off. It's very satisfying. So you can save it for some therapy later.
They come in different.
You smell
Okay,
They come in different flavors.
so your last one is going to be the automixer, which is in our automixture for our hands. You're going to have one loaded with light body, okay? One loaded with, got put in the wrong spot. That's mono phase. I need heavy body. There we go. Since this is brand new, what do I got to do with it?
Squirt some out.
Bleed it a little bit.
Yep, I got to bleed it. Okay, so when you have your light body, it goes to your yellow tips, and then you need an accessory added to it. Okay, so this is what it looks like. You're just snapping it right on here, like so.
Accessory.
Okay, Okay? This is for light body. Why do you think I'm adding this little cute little accessory tip?
Because you want to get the light body up into the socket.
Yep, we're wanting that super cool detail on that prep of our crown, anything that we're trying to capture in our material. Our heavy body, just like we did with our bite registration, is your teal tip, okay? Remember, lock them in. I'm gonna bleed this one first, where I put my tip on. Why would I put a tip on and then bleed it? Why wouldn't I bleed it? All right, I'm wasting a tip. Also, I'm trying to get the extra goo off of that cartridge. Okay, and then you're going to need another triple tray. Okay. All right, so you gathered your appropriate materials. And when we do this one, we are at the chair. Okay. So you have your assistant here, and then you have your doctor here at the chair, and then your patient is in the chair. Okay, so you have this all ready to go. You're passing your light body to your doctor. Okay, your doctor is squirting the light body on the tooth while you are using your heavy body loading the tray at the same time. Okay, and so they're doing their light body all nice and pretty, and you're getting your tray loaded. Okay, so Dr. Nicole, would you please put on the light body so they can watch me do my heavy body? And the whole idea is while they're finished, you have this all ready to go. Okay, so I'm keeping the tip kind of on the top and back and forth. I'm gonna have a good amount. And then I go on the bottom as well, okay? Just kind of like our blue bite when we go buckle-lingle, buckle-lingle. This is the amount you want in here. You need a good amount, okay? We need all captured areas. I'm holding my handle like this. So then and then I take that from her. So then she's able to grab it, and then we place it in the patient's mouth, and then they bite down. There we go. And then usually from here,
cheeks.
Yep, border mold with the cheeks. Okay, and then usually by that time we go ahead and set our patient up because this is going to sit in their mouth for a good 5 minutes. Okay, because we need it 100% set up because this is going to the lab to fabricate their crown. Okay, and did you see how I passed that off?
It doesn't need this like the other one?
Nope.
That's cool.
And so I finished a little bit before she did waiting. Okay. So it's fine. You don't want your doctor sitting there waiting, right? You want to be ahead of the schedule. Okay? So now what do you do with these when you're done?
Remove the
Sanitize
tips,
them.
disinfect,
Yep.
and then they can be reused depending on how much material is left in them.
Correct.
It's a great amount.
Yep. And then always pay attention to the color. Light body is yellow, heavy body is pink, monophase is purple. So don't be putting on a purple tip. I mean, this is brand new, but there is a little pink dot on here. And then there we go. What do you think this is used for?
This is a final.
Yes, this is for a final crown restoration. Back in the day, before digital impressions were taken, this is how you did Invisalign. You had to put a light body on the teeth first and then a heavy body, but that's obsolete now. Everyone does scans. But this is for a final crown restoration. Could be for a bridge, even a veneer. You need a light body to capture all the details of that prep, margins, everything. And then the heavy body is the structure that's heavy. It's holding it in there to capture all the opposing teeth, all the anatomy within that arch. Okay? Pretty simple, right?
Very simple.
What was that first
Easy peasy.
one called?
The first one
This
is
one's
with
impregum.
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 And you can get all these materials in a cartridge to put them in here.
Okay.
Okay? They even have materials called alginate that you can put in here. That is like an alginate. I call it alginate.
I forgot
because you know
about
how to
that.
mix it.
It's not
Okay?
an algae.
But
It's neat stuff
you
though.
still have to treat it as alginate. So, question with all these materials, if I'm going to send it off to a lab, what do I do after I take it out of the patient's mouth? Yep, rinse and disinfect. And so, when you're doing a final impression, your doctor has to A-OK that this impression is beautiful before you can proceed to make your temporary. Okay? Temporaries are another type of goo and material and get all over that prep. And if he does not like this, you're going to have to redo it. Most likely it's going to be beautiful. I'm not going to say never, but there's times that there's going to be a void in it and he's like, nope, we're going to redo it. And so if you had already proceeded to do your temporary, you're going to have all this goo and stuff around that may be on that prep that we don't see because our temporary blends in very well. And then we take an impression and then we sense it off and then it's not going to fit. Okay? So doctor has to A-OK this. Usually this is a doctor thing only. Okay? But I have seen offices where assistants will take the final impression. However, the way they get around that is this is approved by the doctor before it's even sent off because this is a prescription. Okay? So I'm just throwing that out there. You may see an assistant take a final impression and it's okay as long as the doctor approves this. Okay? So if this was a prep, you would see that it's like very detailed along the prep, but it's not. It's a very detailed of tooth number 3. It's very beautiful. And I would say, yes, we're good. So you can go ahead and make a temp. Okay, thanks. Bye. Okay. Pretty cool, huh?
Very cool.
So the first 2 we'll do here at the table, and then we'll have a chair set up to like rotate to do that so you can pass. Okay, I don't have my table mount anymore. I don't know where it went and disappeared. But usually we'd have a table mount out here with the type it on and we would stand as a doctor and an assistant.
There you go, Hallie.
Okay. Obviously there's lots of the handheld auto mixers. There's lots of mixing pads, quite a few impression material or spatulas, but we have to share on these. Okay, and then once you're done with this one, just go ahead and rip it out so then we can reuse it again with the tray. Okay, pretty simple.